What's going on, guys? My name is Steve. Thank you for stopping by my channel. Today, we're going to be reacting to what does U.S. healthcare look like abroad? You know, I've reacted to a few different videos on the NHS system and kind of how the UK healthcare system compares to the American healthcare system and things like that. And one thing that I've noticed in the comments section of those videos is that, generally speaking, it seems like people outside of America have a very negative impression of the American healthcare system. And I think I understand why that probably is. I don't think it's the quality of the health care that people are getting in American hospitals and American doctors' offices, because in my experience living in multiple states, I can say that for the most part, the quality of the health care I've gotten in American hospitals and doctors' offices tend to be pretty good. I don't really have that many complaints with the actual quality. I think what people outside of America are generally seeing as very negative is the extremely high prices or extremely high costs that American citizens have to pay in order to have high quality health insurance. Now, you know, obviously some people are lucky in the fact that they are provided with high quality health insurance through their employer. In 2023, I think that's probably less than ever before, because a lot more people are kind of self-employed, or they work in kind of, jobs that just don't provide the same benefits that they once did. A lot of people are like me, have to provide our own health insurance, and generally speaking, the health insurance, unless you're paying extremely high premiums per month, you're probably going to have a very high deductible, high copay, high co-insurance, and it can be a mess. It really can be. Anyways, guys, I came across this video and I thought it'd be really interesting to kind of dive in and explore this topic a little bit deeper and kind of learn really what people outside of America are really seeing when they look at the U.S. healthcare system, and kind of, be able to kind of understand the system I'm living in from the perspective of people outside of America, if that makes sense. So anyways, guys, enough of my rambling. Let's go ahead and dive in and learn about what does U.S. healthcare look like abroad.
If healthcare is a constitutional right, then
that's a form of communism, because no country could afford those payments without seizing the assets of everybody else.
Welcome to Finland!
Oh!
Dudes, what's going on?
It's a lot of different countries.
Oh my god!
It's making me so mad.
I mean, come on, guys. It's not that hard. Look around the world. Everyone else seems to have figured it out, right? Imagine you're in America. Which of these options would be best for you?
That's
Well, if anybody doesn't understand what this is, basically the premium is what you pay per month. Your copay is, generally speaking, what you're going to pay if you go to kind of your family physician or just to a regular doctor's visit. Your deductible is what you're going to have to pay out of pocket before you are covered for more. Like if you were into the hospital, you would basically have to pay, for example, right here, you'd have to pay the first $8,550 out of pocket before anything else was covered. And this is your out-of-pocket max, meaning this is the out-of-pocket maximum amount you can pay in a year, if that makes sense. So on this plan A, they would be paying $185.12 per month. If they went to their family doctor, they wouldn't pay anything. They have to pay $8,550 out of pocket on top of the premium before some more, before most things are covered, like a lot of labs, CAT scans, MRIs, most of your like things like that, and then this is the amount that they would pay max out of pocket if like they went to the hospital or something like that. So it actually limits them. This is the reason why I actually have health insurance. I don't get health insurance for a doctor's visit or anything. I get health insurance so that if the worst case scenario happened and you get a $100 $200,000, $500,000 bill, it's limited on how much you're going to be responsible for at that point. I think that's really the only reason a lot of people get health insurance is to cover them in those worst case scenarios. And that's why a lot of people don't have the ability to really go to the hospital or doctors for, more regular things, because it's going to cost them a lot of money. And they're just trying to have health insurance to make sure they don't go bankrupt.
Yeah, it's a lot to think about.
What is an OOP max?
I guess with what I got here, I would go with Plan D because the deductible is 0.
Okay, there's more.
Gold, HMO, PPO, HMO.
And what are copays? I don't get. That's like if you pay for Spotify Premium and Spotify still makes you pay every time you listen to a song.
Yeah,
Too complicated.
I'm lost. I'm so lost.
In Canada, I don't have to really think about the different plans that I could pick from.
You just pay one amount per month and all the major treatments are covered.
At least 70% of our medical expenses are always covered.
Uninsured, unable to afford treatment for a tooth infection that keeps flaring up. Cook Emma.
By the way, that is something that has always annoyed me. On every single time someone talks about health insurance, whether it's universal health care or whether it's like just people that agree with the current system or whatever, no one ever talks about the fact that dental should be part of whatever system. It's so annoying the fact that in 2023, they still don't understand how important oral health care is to your overall health. And it's just, why is that not included in my health insurance? You know what I mean? Well, technically it can be. You can get an additional dental insurance added to your regular health insurance for a certain extra amount to your premium every month. But it's usually very limited. Like you get like $1,000 a year in benefits or something like that. And so by the time you have like just your regular couple of visits, your x-rays for the year, and maybe you might get a cavity filled or something like that, you would never have the ability to cover the more expensive stuff, which is the reason you'd want that additional that additional dental insurance in the first place. So it's really annoying that they haven't come to the conclusion yet that, dental care should be part of regular health care, period.
Rittner lost her job in March.
I did manage to get antibiotics from a friend whose mom regularly goes down to Mexico, and I've been taking that, self-medicating, based off of Dr. Google's advice.
Dr. Google's advice.
Half, really? I didn't know that.
Here in Japan, even if you lose a job, you would never lose your health insurance.
When you lose your job, that's when society should help you.
I've chosen a creative job and had the backing of a healthcare system. But if you don't have that, do you pick the safe job or do you pick the creative job?
I think one thing to be said here is that, it is very true that, if you lose your job, you're probably not going to have health insurance. You'll be opened up to the to be able to sign up for the health insurance marketplace. And generally speaking, based off your income, you may be able to get some help there. It also depends on the state. State to state is a little bit different on the amount of help you will get based off your income. And also, if someone is like, very, very low income, if someone's very poor, usually they will qualify for Medicaid, and they'll basically get very low and usually free health care provided by the government. And obviously older individuals that are like, I don't remember exactly how old you got to be to sign up for Medicare, but at some point you sign up for Medicare. For a lot of older people, it doesn't cover everything. Even they have to get some kind of supplemental health insurance in a lot of cases for that. But it's not as straightforward as everybody has to pay an arm and a leg for health insurance. But still, A lot of people do. Like probably half the people in this country have to pay a ton of money for their health insurance. It's just a fact, and unfortunately. It's just way too expensive. And a lot of that, I will like to add here, a lot of that I believe is also the kind of sue happy culture that is in America, unfortunately. I mean, it's like, and then the doctors have to have, the medical professionals have to have, lots of extra insurance they got to pay. And then all the prices go up across the board. It can cost, like, you go to a hospital, you look at your itemized bill, and it may cost $50 for a bandage that literally costs the hospital 50 cents. And, there's just all sorts of little things like that that's just wrong in our system that's causing this very expensive health care. And it's just a shame that in 2023, we can't figure out something better. Honestly, like, we don't even have to fully agree on, in this country, I'm guessing we probably wouldn't agree on anything to fully solve the problem. But like, you would think we could come together and, do something that was a little bit better. You know what I mean?
The average price per unit for insulin in 2018.
Germany, $11.
Canada's $12. Wow. It's like 8 times the price.
I honestly was betting to be more than that. It's a shame that something that is needed to save someone's life. I mean, some people diabetics can't live without their insulin. And it's a shame that this is a thing. If you got something serious like that, like diabetes, and you need something to survive, literally like insulin, you should never have to worry about the cost at all. Period. Now, granted, obviously health insurance will cover whatever it covers, depending on the quality of health insurance. Obviously, you got Medicaid. I'm guessing it would cover it completely. But still, the fact is that it just shouldn't be a thing that people ever need to think about, something that they need to live. In 2023, it just should not be a thing.
Price of insulin in Canada. I guess that explains why Americans come up to Canada to buy medication.
I've heard that.
I'm sorry, hold on. So the FDA doesn't have any authority over the prices?
We have also privatized health insurance companies in Germany, but the prices are regulated by the government.
The government negotiates the prices and fixes that price for 2 years.
In Singapore, they regulate this stuff to keep the prices down and, avoid like this happening.
Like, seriously, that type of thing, it makes you think, it's like, why can't both sides come together to do something like that? That we, because that's not really even, that wouldn't even take having universal health care to do something as simple as say, you know what, we're going to regulate the amount of pricing for insulin. It can't be more than blank, period. What are we looking at here? Inpatient services. Total patient services. Room and care. Look at this. Look at this right here. $428,000 for room and care, man. I don't know what this bill is for, but you got to wonder how long they were here for. I mean, it's pretty ridiculous.
Right, so I'm looking at an American medical bill.
Why is it so expensive?
$428,000 for rooms and such empty spaces. What?
Much cheaper to go Hilton Hotel than this one.
Skin to skin after a C-section is $39.
I had to pay $39.35 to hold my baby after he was born. You need to pay money to hold a baby?
No, I've heard that before. I've obviously been around for multiple births, even just 4 years ago. Well, 4.5, whenever it was, 2018. But for my daughter when she was born, and I've been around for a number of other births, and that's not a thing anywhere I've gone. I think it depends on the state. It probably depends on the hospital. They're probably just going to trying to nickel and dime people there. You know what I mean? And a lot of times they realize they can bill the insurance, so they're just like, the insurance just cover it. But yeah, that's absolutely disgusting. Whatever hospitals do that, like, I'm not paying to hold my baby if I'm a woman that just gave birth. I'm not paying to hold my baby. I'm holding my baby, and you're not going to do anything about it. You know what I mean? It's disgusting. That's even a thing, man. But yeah, I don't know where that's at. That's pretty crazy. I believe
brother
that.
Jamie, who's in a lot of our videos, was pretty badly injured. He's going to lose a couple fingers. If you can give $1 or if you can give $5, every little bit will help him and his family.
That's heartbreaking.
GoFundMe should not be something that people have to resort to pay for their medical bills.
So in America, people spend more than twice as much as in Japan for healthcare.
You know, if I paid twice the amount for a car, I would want the car to be twice as good.
So what's the life expectancy in the U.S.?
Why is it less?
Well, I believe the less. I just like to say this. I don't think it's the quality of care that people are getting in the hospitals and doctor's offices, at least from my experience. I can't talk for everybody. There's probably lots of areas in this country that the healthcare is not good. Probably different states are going to be different. But I think the main reason for that is because people don't get care for things that when they should, because they don't want to pay the prices, and then it builds and becomes something much more problematic later. When if they had the ability to go to the doctors cheaper, go to the hospital, not pay so much, not have to worry about the bill, then they might go earlier. And, that life expectancy would be, a little bit higher at that point. Plus, you can also say, honestly, our food quality, the chemicals in our food, from what I've seen when it comes to food quality in the UK, at least, I don't know about all these other countries, but I'm just can say off the UK, the food quality, is much less chemicals and things like that in the food. And I think artificial stuff, I think also our serving sizes are a lot bigger than probably most of these countries, maybe all of them. And so I think that has a lot to do with the lower life expectancy there. But yeah, let's continue.
The U.S. should be on top of both of those lists. Like, if you're charging your citizens that much money, then they better be living the longest lives. It doesn't make sense.
When Alec turned 26, he was no longer allowed on his mother's insurance plan. Instead, he decided to pay for his insulin over the counter at list price. But the pharmacist told him a month's supply would be $1,300. He left empty-handed. Alec's official cause of death was diabetic ketoacidosis.
So yes.
A couple of years ago, I developed a heart condition.
That's the type of thing that it upsets me that, like, because we're so partisan in this country, because we're so divided, you have people like me that would gladly sit down with both sides of the political spectrum and try to come to some sort of resolution to, where everybody feels like they win a little bit. Because things like that should never happen in a developed nation of any sort. If you need insulin to survive, you should never have to worry about the cost of it, period. The end. There was a time, hundreds of years ago, sure, you're on your own. But in a civilized society in 2023, can we not make sure diabetics have what they need to survive without them having to worry about it? I mean, I would think that people across the board from both sides of the political aisle would say, yeah, absolutely. And I think that for the most part, people from both sides would agree to that, when you're talking to them individually. But the problem is they're not willing to sit down with the other side. Both sides are not willing to sit down and kind of hash out a deal, meet in the middle on what we can get done to make things better when it comes to healthcare.
And I had to have my heart restarted 3 times. After the 3rd time I had it restarted, the doctor suggested I get heart surgery.
When I was 13, I started to get sick and really, really sick. I was then very quickly admitted into hospital, where after 3 weeks, I had treatment for a brain virus.
The cost of the operation, I think, is about $60,000. And then the next day, when I left the hospital and I got my bill, it was a bill for parking. It was about $30.
And was treated by royal doctors, had several MRIs, lumbar punctures, all for free.
So I was pretty happy that I lived in Canada and had universal health care.
I couldn't have survived if I was in America.
To know that I can get sick, I can get injured, but I will still be taken care of. That is freedom. This is not freedom.
Man, guys, that was a heavy video. Yeah, it's hard, man. It's like, I think I, for the most part, said everything I had to say about it right now when I was going through it and stopping. But yeah, it's just, I don't understand why we can't just meet in the middle. I say this all the time on kind of more politically, I don't want to call this politically charged, but we all know that generally speaking, it is fairly politically charged to talk about the healthcare system and stuff in America. And it shouldn't be. It should be like, okay, you agree, you believe in this and you believe in this, but don't you both believe there's a better way to do things than is currently happening? And it's like, I literally think that everybody across the board would say, yeah, I don't like, I don't know. I don't want to ramble too much, but it's just something needs to change, man. I mean, the diabetic example is the perfect example. Like, it's just one, it's like, if you need insulin to survive, you should never have to worry about it. You should never have to worry about it. And that's one thing that I've always said. To get full on universal health care in this country, get something like the NHS, probably be very hard to pass. I don't know if that would be possible, at least in today's society, mainly because we're just too partisan to even talk about it. It's pretty ridiculous. No one wants to talk to each other because we're just become so divided. And you don't get anything done when you're divided. But, it would be nice if we could come together and just be like, you know what? I don't agree with you completely, but you know what? Let's see what we agree on. And we don't have to look at our disagreements. What do we agree on that we can improve? And you know what? We could have an improved system in a month. It's just, anyways, guys, enough of me rambling. Thank you so much for stopping. Please click that like button. Feel free to drop your comments or suggestions about this video. And don't forget to subscribe to continue to follow me on my journey to discover my British and Irish ancestry. Until next time, guys, peace.